Hello, everyone. Today I'm going to be discussing physician assisted suicide and the ethical considerations surrounding the topic. Today's discussion, I will first do an introduction, then I will go through the history, ethical issues, and then I'll cover professional ethics, um, the benefits of having an ethics committee, and then finally I'll go through the conclusion. So, why did I choose this topic? I was a certified nursing assistant for many years, and oftentimes I had to work with patients in hospice. It was honestly very heartbreaking to see them suffering and experience firsthand how slowly their bodies would shut down over the span of months. Oftentimes, patients did express their feelings of hopelessness and frustration. So, they honestly were just tired of pain and suffering. And I honestly can't help to think that if they did have the opportunity to pick or choose this option of physician assisted suicide, would they have gone through with it? I'll also share my thesis with you all. There's a lot to unravel when taking the ultimate decision on whether or not the patient should move forward with their wishes. The healthcare industry is no stranger to these types of ethical dilemmas, and we must be prepared to handle them appropriately. So, what exactly is physician assisted suicide? It is defined as the act of when a physician facilitates a patient's death by providing the necessary means or information to enable a patient to perform the life ending act. So, basically, once the patient goes through the necessary steps and they're approved, the physician will give them the fatal dose necessary to take to end their lives, and they will provide them with instructions on how and when to take the dose. So, as long as the patient is able to take the dose on their own and understand what they're doing, um, then they can move forward. So, next, I'll discuss the history of physician assisted suicide. So, the Death with Dignity Act was first passed in the United States in Oregon on October 27th, 1997. It was the first of its kind, and it allowed individuals with terminal illnesses the right to assisted dying. As of now, it is currently legal in the United States in California, Colorado, District of Columbia, Hawaii, Montana, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington. There are areas outside of the United States where it has been legalized prior. And the first place it was ever legalized was in Switzerland in 1942. And I will share this map. So the dark purple is the states where it is currently legalized, and then light purple is where it's pending legislation. There are many reasons why it's not legal in all of our states and why it's still pending in many. And this is because of the many ethical issues that come with physician assisted suicide. So, one of the ethical issues is the concept of slippery slope, um, which basically means that once we start to legalize, or I guess accept more and more cases of this and legalize it more in the United States, it'll come to a point where we might just be accepting cases where previously we would have not. So it might come to a point where it's very easily accessible and people are using it as a primary option instead of a last resort option. This could lead to abuse and cases where they are just very highly unethical. Um, so there are factors outside of, I guess, the suffering and pain that lead to the ultimate decision of an individual, which could be a risk. One of them is mental health. So if we look at the primary population of people who are requesting physician assisted suicide, it's the terminally ill and the elderly. So studies do show that up to half of these individuals who have advanced illnesses such as cancer and the elderly suffer from symptoms of depression and suicidal thoughts. And then some statistics to think about is that in Oregon, greater than 70% of patients who elect physician assisted suicide are elderly and have cancer, but fewer than 5% are referred to a psychiatrist or psychologist to rule out any clinical depression. Having depression that can lead to suicidal thoughts does not qualify someone to be eligible to go through this process. So it is very, very important that doctors are making sure that they're going through the necessary steps with these patients before they're accepted. They do have to be evaluated thoroughly. Make sure that there's no mental health issues that could that are untreated that could basically end up influencing a patient's decision. Finances can also take a huge role in this. Um, so basically, data shows that 33% of medical costs spent in a person's last year of life are spent in their last month. Medicare data indicates that uninsured families can save nearly $60,000 in end of life costs if a patient were to choose physician assisted suicide 6 months before their natural death. This could be a factor for many because, especially if they're being taken care of by family members, we know that family caregivers do have to take time off of work to go care for these people, which obviously reduces income for them. They do have to spend money on, I guess, medical treatment, keeping up with hospice, having another caregiver go take care of them. It can become very, very costly. Oftentimes, individuals who are heavily dependent feel very vulnerable and a burden to their family as they require high levels of care and attention. It is well known that that the feeling of being a burden to others is frequently experienced by patients in palliative care. 19 to 65% of them say they experience strong negative feelings of suffering from their belief that they are a burden for those who care for them. So, many individuals who are against physician assisted suicide argue these things. So, we wouldn't want to end up in a situation where family members are, I guess, pushing an individual to make this decision, or an individual is, I guess, pushed to make this decision um, based on how they feel a burden to their family and just feel like they're taking up time and money. One of the requirements to be approved is that you have to have a terminal diagnosis and have a life expectancy of 6 months or less. But there's always that risk of a doctor giving an incorrect diagnosis. A study done on cancer patients actually found that most patients who are given a diagnosis or prognosis of 6 months to live actually end up outliving that. Um, Studies show that actually 20 to 50% of patients outlive their prognoses. So there's also that risk always if somebody gets approved based on this criteria. How do we know that it's valid? I also wanted to share this short video with you all, just so you guys can have a better understanding of why it's important for patients. To save time, I will share the link in my discussion post. Next, I'm going to discuss the importance of professional ethics. So, professional ethics refers to the ethics that a person must adhere in respect to their interactions and business dealings in their professional life. When we compare this to personal ethics refers to the ethics that a person identifies with in their everyday lives. Professional ethics is so important to understand and know how to implement it in the workplace so that your personal ethics do not get in the way. Our personal ethics may influence our choices many times, but it's not professional to apply those beliefs in the work setting. So, with physician assisted suicide specifically, a physician can have a certain belief of I guess, giving everyone the right, regardless if they fit within the criteria or not, but professional ethics says otherwise. Or a doctor could be against the topic due to religious reasons, but that shouldn't allow them to influence the patient in any type of way based on their beliefs. And that's when professional ethics comes in. For this reason, it's also really important to have ethics committees in these situations. With this being such a delicate case, it's important for them to be involved in these cases and just make sure that all legal and ethical criteria is met. They should review cases and make sure that individuals who are approved to move forward with this are capable of making their own decisions, and that this request is appropriate for their situation overall. They can also be there for families to provide education on what's going on why their family member may be picking this as a decision. Overall, they're there for physicians, patients, and family members when there's difficult decisions to be discussed and made. So, in conclusion, there is going to be a huge impact if we do legalize it in more states in the United States. There are a lot of people who really, really could use this and are really looking to have it legalized in more places because they want to have a say in their healthcare and in their life, and this and legalizing it. But we still have to keep in mind that there's so many ethical considerations regarding the topic that we have to prepare healthcare professionals and educate them on how to best handle these types of situations, especially because this is such a hard topic to um, deal with. There needs to be additional measures put into place, additional education for both physicians and individuals who are looking to go with this option. But I strongly believe that as long as we put the correct guidelines in place, that we are able to legalize this in more states, um, and have it be successful and have it be something that can help many, many individuals.